Hi, it's Dr. Scott with Revitalize Medical Group. Today I want to talk about hip flexors. It's not like your typical topic that I would normally talk about because it doesn't have specifically to do with hormone imbalances or functional medicine, but it's something that has made a big difference in my life the last month. So today I had to drive some kids an hour up to a speech camp in Cleveland, an hour back, so that was 2 hours I started out in the car, and then tonight I'm going to have to drive down to college orientation for my oldest daughter, so that's another 2 hours in the car. And so I normally don't usually like to sit a lot. I had started a job when I was delivering babies. I would stand to deliver babies, I would stand to operate and do C-sections, and I really wasn't sitting that often. I was walking around the hospital monitoring labor progress, and so if I was in the office, I would stand at a desk to document in between, and I would only sit for little points of times in between with pap smears. But now I've changed my job to mostly a consultation office-based job where I'm sitting a lot. And I noticed that after I sit for a long time, I would really have some low back pain, some problems in my hamstrings and my hip flexors. And the hip flexors are those muscles that are in your groin. So when you sit all day long, you're contracted, and that causes pulling on your back and your hamstrings. So it causes you to be out of balance. So I didn't notice this was really a problem until I noticed I started having it with my running. And so then I started paying attention to the amount of steps that I do and the amount of standing that I do, and I don't really stand enough on the days that I'm working. So I'm considering getting one of those standing desks where it's supposed to be really good because then you're not always contracted with your hip flexors. I Googled some exercises to unlock my hip flexors and to stretch out my hamstrings, and it helps. It's about 10 or 15 minutes to do it. I try to do it almost every day. So if you're suffering with some of the same issues and you sit a lot, you might want to ask your doctor or a physical therapist to walk you through some of those exercises, or you could just Google it like I did. I think it's really made a difference. And the thing I didn't realize is that muscle, the psoas muscle, which is deep in your back inside, the adrenal gland actually sits on that. So every time you're stressed, it actually innervates the same as the adrenal gland, and so it can cause a constriction in your back. So a lot of times we hear about people who got stressed out and threw out their back. Does that sound familiar? So it could be a problem with your hip flexors. So I'm going to think about investing in a standing desk and consider using that. But if you're having the same problem, I encourage you to take the same path I did and really think about doing some stretches for that.